Now, you're a medical doctor, you're a gynecologist. How do you differentiate issues that can be addressed via coaching versus the ones that really need medical attention? And how do you go about handling that situation?
Yeah. So, differentiating between what can be addressed medically and what is coaching is, I think, takes a lot of experience and knowledge. And I think what's important to know is, really figuring out why the client is there, right? What are their goals? What is it that they're trying to achieve in that 1 hour that you have for that one-on-one coaching? And, the client will tell you, like I recently had a woman that had vaginismus. So if your listeners that may not know what vaginismus is, it's the involuntary contractions of muscles surrounding the vagina that happens in anticipation of fear due to penetration, right? So when this woman came to me, I had to figure out, one, was she having pain? Was she having this fear of pain of penetration due to, say, something anatomically going on in the vulvar region, right? Is she having vaginal dryness? I had to look at her age. I had to look at what was causing this vaginismus that she was experiencing. What were the external factors? So that's a lot of times what I do in terms of trying to figure out if it's medical in origin.
Mhm.
Then, if I know that say that she's had a recent medical exam already, and somebody has examined her, because my consultations are virtual, so I wouldn't be able to examine her, and she'd have to be in the same state for me to see her as a physician, to have a doctor-patient relationship. So, anyways, what I had to do was figure out, what was causing that vaginismus. So we went through the anatomical reasons. Is it that she's postmenopausal and she's experiencing vaginal dryness? Is it that she has a little bit of atrophy, right, of the vagina because she's postmenopausal? Is it that she has something else going on in her vulvar region? Maybe she has an infection, something like that. So, those are things that you have to kind of sift through. And then after that, if everything comes out negative, then you work through the psychological or the cognitive part of it. So, which is, what are her thoughts surrounding sex? How does she see sex? Does she have a negative belief about sex? So for this specific individual that I'm thinking of, what she and I discovered was that she was a devout Christian, and she really believed that for her, sex out of marriage was wrong. And so when and she had been divorced for a long time. So now she was in a new relationship, and she wanted to, figure out why she was having this vaginismus. And then when we realized that it was her feelings, and, then we went and we talked a little bit about her feelings, and she felt like, having um, extramarital, intercourse or having sex outside of marriage was wrong, that it was, something that she should not be doing. Then we realized that, for her, that could have been the cause of her vaginismus, that she was in that when she tried to be physically intimate with her partner, she would have those thoughts that, this was wrong, she shouldn't be doing it. And then automatically, those muscles would tense up. So for her, that was a big aha moment, because she didn't realize before that her thoughts and her feelings about sex and what she was doing was impacting the way that her body was reacting. So that was kind of how we worked through both the medical aspect of what was going on with her and also the coaching part of it. So for her, then we worked through what her values were and what she needed and what was important to her. And she realized that for her, it was important, and she was getting married anyways. But for her, she realized that when she was previously married, she didn't have issues with vaginismus. So she realized that it was only now that she was having this issue with vaginismus, but it was that she wasn't married yet to this individual. So she said she's getting married in February, and, she would think that perhaps she wouldn't have those issues. But also, it wasn't just the coaching, right? Because the coaching, of course, you and I both know that coaching is all about moving forward in somebody's life and what's holding them back and how they can move through it. But also for her to see a pelvic floor therapist that would work with her with dilators. So for vaginismus, it's always a two-pronged approach. It's the physical component of it, of working with dilators and things like that, but also the psychological component. And so that's how, we got her to where she would eventually be able to have intercourse with penetration.